Hey everyone, my name is Dr. Soren Paape from Smile Now Dental Group. If you've been wearing dentures for 10, 20, or even 30 years, you might be wondering, is it too late for dental implants? You may have been told you don't have enough bone. You may feel like your mouth has changed too much, or maybe you've just been living with discomfort for so long, you're not sure if anything better is possible. Well, here's the honest answer. It's not too late. And in this video, I'm gonna explain why, even after decades in dentures, you still can get implants and how we help patients just like you take that step. Let's start here. We see this every single day. Patients who have been in dentures 15, 20, even 40 years who finally decide they've had enough of the slipping, the glue, the sore spots, the worry. Many of them walk in asking, am I even a candidate at this point? And in most cases, the answer is yes. With the right approach and the right team, you absolutely are a candidate. Here's what happens over the years with traditional dentures. Your jawbone is gonna shrink because it's no longer stimulated by tooth roots. The dentures rest on soft tissue, which can lead to pain, sores, or instability. The lower third of your face can begin to collapse, making you look older than you are. Your chewing power drops significantly, which can affect nutrition. You may stop smiling, eating certain foods, and even avoid social situations. But all of this is reversible if we intervene and give you the right kind of care. Usually the biggest concern is, do I have enough bone left? Haven't I lost too much bone for implants? The truth is, you may not need bone grafting. Thanks to modern techniques like all-on-4 and all-on-6, we can often place implants at angles and take advantage of that bone that you still have, even if it's thin or recessed. We also use 3D imaging to assess your bone structure in detail, and we perform all the planning and surgery in-house, so we can be flexible and precise with your treatment. And even in more advanced cases, we have options like bone grafting sinus lifts, zygomatic implants for extreme cases, or custom full arch prosthetics designed to work with your anatomy. So no, 20 plus years in dentures does not automatically disqualify you. Here's how the journey usually goes for long-time denture wearers. 1, you come in for a free consultation and we take a 3D scan. 2, we evaluate your bone and build you a personalized treatment plan. 3, on surgery day, we place your implants and give you a fixed same-day temporary teeth. No more taking dentures in and out. 4, over the next few months, your mouth heals and we realign your final prosthetic based on your comfort and feedback. And then finally, you will leave with a permanent, stable, and beautiful smile that doesn't move anymore and it feels like a part of you. The entire process is designed to be as smooth and comfortable as possible. One of the things I hear most often from longtime denture patients is, I had no idea what I was missing. I feel like myself again. I wish I had done this 10 years ago. It's not just about chewing steak or ditching adhesives. It's about the confidence, freedom, and getting your life back. You don't realize how much your dentures are holding you back until they're gone. Let me say this clearly. You are not too old. You are not too far gone. You have not waited too long. You are not the only one feeling this way. We specialize in helping patients just like you, people who have been told they're not candidates or assume that this wasn't an option anymore. With the right tools, experience, and care, we can help you make that switch safely and confidently. If you've been in dentures for years and you're ready for something better, we're ready when you are. Make sure to click that link in the description to schedule your free consultation at Smile Now Dental Group. We'll take a look, walk you through your options, and help you decide if it's time to make that change. Thanks again for watching. Be sure to like and subscribe for more real answers. See you in the next video.